Okay, let's talk about some test-taking tiebreakers. So I don't want you using these strategies as your first tool. Okay, I want you to use your knowledge and your judgment, your critical thinking, and the strategies that I'm teaching you. I don't want you to go straight to these tiebreakers, but there are going to be times on the NCLEX when you've narrowed it down to two of the answers and you need to choose between them. And you're also going to face questions on the NCLEX about material that you've never seen before. Right? I guarantee you. That's why everybody who walks out of the test says, oh my goodness, that was the hardest test I've ever taken. Well, why is that? Well, that's because every question that the NCLEX asks you, they calculate that you have a 50-50 chance of getting that question correct based on your past performance on the exam. So if you get a question right, it's going to ask you a more difficult question. And if you get a question wrong, it's going to ask you a slightly easier question. But each question, they calculate you have a 50-50 chance on. So it's going to be hard. There's no gimmies on the NCLEX. So first thing, use your nursing knowledge. Second, use your critical thinking and your strategies. And then the last thing, go to some of these tiebreakers. Okay. For general test taking, though, number one, you can rule out absolutes. Okay. So words like always and never, very rarely are those going to be the answers. Okay. Because very rarely does something always happen or never happen. Secondarily, I want you to look and see if two answers are the same thing. Because if two answers are the same thing, then neither one of them should be correct. So something like tachypnea and fast rapid breathing, right? That's the same thing. So they're not both correct. So both of them must be wrong. The third thing is if two answers are opposites, you should probably consider one of them. So if it's tachycardia and bradycardia, then you should really consider those, that it's one of those two. Another strategy is to look for umbrella answers that include other answers. Okay, so, this example question, in the emergency department, the nurse is caring for a client placed on suicide precautions. Which intervention is most important? So they're asking you, what's the best thing to do? Well, we have some strategies for what the best thing to do is, but here we can look for an umbrella answer, so something that covers all of the other things. So remove sharp objects from patient's person, yeah, absolutely. Initiate suicide precautions, absolutely. Remove patient's belt, absolutely. Assign an aide to observe the patient 24/7, great ideas. But if you look at A, C, and D, they're all included in the option to initiate suicide precautions. So that covers everything. So suicide precautions is the best thing to do because it includes all the others. Okay. Now, sometimes you're going to get stuck between two answers. And like I said, these strategies can work for differentiating between those last two. But when you get down to two and you're still having trouble, go back and reread the question. Okay, there might be some word that jumps out at you the second time you go back through and read it that you didn't see the first time, and now that you've been debating between two answers, you have a different way of thinking about that question and to see if any of those words in the original question should jump out at you. Another strategy you can use is the Sesame Street rule. And the Sesame Street rule is in relation to that old Sesame Street song where, one of these things is not like the other. Three of these things are kind of the same. Well, it's the same for the NCLEX. So, here we have this, fictitious drug side effect. And let's look at our answers, right? So, GI cramping, heartburn, peptic ulcer disease are all kind of the same. Joint pain is very different than those others, right? Because the others are all GI side effects. So let's look at the one that stands out. Okay, in this case, that would be joint pain. Now, that's a fictitious drug. Pay no attention to that. So another thing that I see test takers do is they fall into the trap of answering a question based on their own ignorance instead of on their nursing knowledge. You also see patients answering based on their personal experience, which is bad also. So some people who have been a patient care tech or an LPN prior to taking the RN exam, Yeah, you have a basis of knowledge that's helpful, but it can also be hurtful because you start to think about, well, when I had a patient with such and such, or every time I've seen such and such, well, you can't use your own experiences. You have to use the generalizations. So don't be tempted to answer based on your own ignorance instead of on your knowledge. So, for example, what's the most important thing to do in the administration of amikacin IV piggyback? Right. So, if you've never heard of that drug before, you're looking at, you're saying amikacin. Well, I've never heard of that before. And, cover the bag with foil to protect from light or use an IV pump. Well, I've never heard of that drug, and I've never heard of covering a bag with foil. So, if they're asking me that, then it must be really important. So if I've never heard of that drug, I must have never heard of the side effect, or I must have never heard of, what we need to do for that. So let's cover it with foil to protect it from light. Well, you just made an answer or selected an answer based off of your own ignorance. Now, what I want you to do in this situation, the strategy is to take out the name of the drug, okay, and reread the question. What's the most important thing to do in administration of an IV piggyback? And now look at the answers, okay? When administering an IV piggyback, is it more important to use an IV pump or to cover the bag with foil? Well, it should jump out at you that when giving and administering an IV piggyback, you need to use a pump, okay? I don't know of many situations where you're going to be administering drugs without pumps. Pretty much everything is hung on pumps these days. So the first thing that the NCLEX and the NCLEX-PN and your state board of nursing want to do is make sure that they're giving you a license and that you have proper judgment to use it, right? So do you think that there are going to be situations as a new graduate nurse where you don't know what to do? Absolutely. It's going to happen to you a couple times a day, right? So even experienced nurses, they'll tell you that they don't have it all figured out. They still ask tons of questions. So if you don't know what to do about administering a drug, do you really want to tell the state board of nursing that when you don't know what to do, you're just going to go around covering bags with foil? Or do you want to tell them that but I'm not really sure what to do about this, so worst case is I'm going to hang it with a pump? Who would you give the license to, right? Who do you want to be your nurse? The person who didn't know what to do, and so they covered a bag with foil, or the person who didn't know what to do, and so at least they hung it with an infusion pump? Next tip, if something seems correct, it probably is, right? Correct answers are different. There's a reason that it looks correct. Right? So use your nursing knowledge, okay? Don't simply use strategies. Don't simply use guessing. Don't simply jump right on the first thing you see, but there's a reason that they're correct. That the answer jumps out at you because it is correct. Correct answers just look different, right? So when they wrote the question, they started off with the correct answer. Then they had to make up answers that are wrong when they were writing the test, right? So there's a reason that one answer looks correct. It's because the other ones are made up, right? Now, if you still don't have any idea about an answer to a question, you do know the answer to the question, right? Use your common sense. Step back and look at the big picture, and then start eliminating some of the possibilities in some of the answers. So go back to high-level stuff you remember back from A&P, stuff you remember from pharmacology, just big kind of huge concepts, and see what stuff makes sense, and then start crossing out the things that don't necessarily make sense based on the information that you have. So those are some good test-taking strategies and tiebreakers. Right? So again, the first thing you want to do is use your knowledge, not your experiences. The second thing you want to do is use your common sense, right? The third thing you want to do is use these strategies. The fourth thing is use tiebreakers. Right? So for psych questions, the best thing to do is the nurse will examine their own feelings about whatever the topic is. Okay, because until you understand where your own judgment, where your own bias, where your own feelings are going to influence how you're caring for that patient, until I've identified those, you can't come at it from an objective fashion. Okay, so the second best thing to do in any kind of psych question or psych relationship is to establish a trust relationship. Can you ever really care for somebody, whether it's on a med-surg basis or on a psych basis, if that person does not trust you? Okay, there's a reason that they are in your care. It's because they trust you. Right. Now, nutrition questions. In a tie, go with chicken or fish. Always pretty good answers. Never pick casseroles for children. Okay, the flavors are all mixed up, and kids don't like casseroles. Yeah, some kids like some casseroles. You're right, Mom. But on the NCLEX, never pick casseroles for children. Number 3, you never want to mix meds in children's food. You want to select finger foods for toddlers. Give them something they can grab, something they can work on developing their fine motor skills. All right, transferring from that palmar grasp into that pincer grasp. For preschoolers, leave them alone. Okay, 1 meal is fine for a preschooler. 1 meal a day. Okay, they are not growing as fast as they were. They are developing differently, and they do not need the same volume of food that they had before. All right? Don't force them to eat. This is not a good time to be teaching the kid to clean the plate, and that there's starving kids in some other part of the world that would like to eat what's on their plate. If they don't want to eat it, don't make them eat it. Okay? They will eat if they are hungry. Pharmacology questions. The most commonly tested area in pharmacology is side effects. And then secondarily is probably patient teaching. Right? Because what do we do as nurses? We're not writing orders. We're not determining what to give them. We're not determining the dose. We're not determining the route. We might question some of those things, but that's not for us to determine. That's a medical decision. So what we do know about as nurses are the side effects of drugs. We need to be able to identify them and to teach our patients about them. And we also need to teach our patients about the drugs that they're taking, what the how they're working, and what side effects that they should watch out for, how to deal with those side effects, and stuff like what to teach a patient who's taking Coumadin. Right? You need to teach them, don't eat foods that are full of dark leafy greens, right? So no kale, no spinach, no collards. These are things that we need to teach our patients, because those are foods that are full of vitamin K. And what's the antidote to a Coumadin overdose, right? To an elevated level of Coumadin, you give vitamin K. So that's why we need to reduce the consumption of those foods. So if you're answering a pharmacology question and you don't know what a particular drug does, take a look at where that drug acts in the body and select a side effect in the same body area or system. So if it's a GI drug, don't pick a cardiology side effect, right? Pick a GI side effect. If it's a blood pressure medication, don't pick a sedative-like side effect. You'll want to choose something that's cardiology related. Right? Pick something in the same body area or system as the drug works. So if you don't have any clue what a drug does and they've administered it PO, so by mouth, select a GI side effect. Right? Now these are tiebreakers. These are like Hail Mary passes. These are not the first tool you should use when answering these questions. Go with your nursing knowledge, use your judgment, use your critical thinking. But if you've never heard of a drug before, then these are some good tips. And lastly, for pharmacology, never tell a child that medicine is candy. Okay, it's not candy. We don't want to give them away, their medications to their friends because they're candy. So OB, if you don't have any other clue about an answer for OB, It's never a bad idea to check fetal heart rate or assess the fundus. Right? Now, if you assess the fundus, it might say you might want to massage the fundus. You might notice that the fundus is not midline and that they need to drain their bladder. So assessing the fundus is going to cover a bunch of other options. Right? For med-surg questions, there's things that you should do and things you should assess. Okay. The first thing you should assess is the patient's level of consciousness. But the first thing you should do is establish an airway. Okay. I talk about how ABCs are failed in some of our patient prioritization lectures, but in this situation, the first thing you should do is establish an airway. Now, pediatric questions. I have a couple strategies to share with you here. And there's 3 rules that govern growth and development, and they all have to do with the principle of giving the child more time to develop, more time to grow. Right. So number 1, when in doubt, call it normal. Okay. If you have no idea, call it normal. So in this example, the nurse is caring for a 6-year-old client, and the mother is concerned that the child is not yet able to read. What is the appropriate response of the nurse? A, call a child life specialist. B, perform a developmental screening test. C, reassure the mother that this is normal. Or D, suggest audiobooks instead so the child does not fall further behind. Okay. All of those options make sense, right? So the best thing to do is to reassure the mother that this is normal. The child will develop at their own pace. Okay. The second strategy is to pick the older age, right? It's essentially giving the child more time. So these are questions like, at what age should a child be able to do X, Y, and Z? Right? So here, the example is, what age should a child be able to walk independently? Okay, 3 months, 12 months, 14 months, or 2 years. So when you see these, you look at it and you say, well, I know kids that walked at 12 months, but I know kids that weren't walking at 13, or I know kids that were walking at 9 months, so which one do I go with? Because 9's not there, and 12 is there, and so is 14. So 12 months and 14 months, they're both correct in life. On the NCLEX, the correct answer is to provide the older age. Give the child more time to learn how to walk. Right? So this is for not a specific child. This is the generic child should be able to walk independently by 14 months. Okay, so go with the older age. And the third strategy of giving the child more time to grow is to pick the easier task. Okay, so in this situation, the question asks, a new graduate nurse is caring for a 6-month-old girl. What task should she have mastered most frequently? Okay, a social smile, rolling over, sitting up, or a 5-word vocabulary. Well, again, rolling over and sitting up are essentially both correct, right? You have 6-month-olds that can sit up, and you have 6-month-olds that can roll over. Well, we want to give the child more time to sitting up, right? So it's okay if they haven't learned how to sit up yet, but they should all be rolling over by 6 months. Okay, so they're both correct. So we're going to choose the easier thing to do, right? Because that's what they should have done, and we're going to give them more time to master that slightly more difficult task. Okay, so as you're driving down the road and you're thinking to yourself, okay, what do I do for pediatric questions? You need to be thinking, when in doubt, call it normal, pick the older age, or pick the easier task, all right? Normal, older, easier. Normal, older, easier. And those are some great strategies that you can use for answering pediatric questions. So as a quick summary to all of these test-taking tiebreakers and general testing strategies, remember, the first thing I want you to do is to use your knowledge, okay? Use your nursing knowledge, the stuff that you've been taught. Don't use your experiences and don't use exceptions, all right? And don't guess based on your own ignorance about a topic. There's going to be tons of stuff on the NCLEX that you do not know about. That is perfectly okay, all right? So, then I want you to use your common sense, and I want you to use the strategies, and then I want you to use tiebreakers. So don't go straight to a tiebreaker, okay? Don't go straight to chicken, all right? But when it comes down to breaking a tie, chicken's usually a good option, okay? So remember, the NCLEX is going to be hard. That's okay, all right? When you get to the NCLEX and it's asking you impossible questions, don't freak out, okay? That means you're doing well. If it's asking you a bunch of questions and you're looking at it and you're thinking, I'll bet all my classmates know this answer, then you may want to be a little bit concerned, right? But when it's asking you about drugs you've never heard of, what I want you to do is ask yourself, have 10 of my classmates ever heard of this drug? Or do 10 of my classmates know the answer to this question? And if the answer is no, then don't sweat it, okay? It's asking you difficult questions because you're doing well. Right? There was a couple times on the NCLEX when I was taking it where it asked me about a drug I had never heard of. Right? One of them was about a disease process I had never heard of. So instead of freaking out, I asked myself, do 10 of my classmates know about this? Do 10 of my classmates know this answer? And I realized they have no idea either. Okay, so instead of fretting about it and wasting a bunch of time, I eliminated 2 of the answers that just looked weird. Right? And then I guessed between the others and I went on. Okay, I didn't waste a ton of time on those questions because, I probably missed that question or 2, but that's okay. You're going to miss a bunch of questions on the NCLEX. That's just the way it's structured. So think about it this way. All right, here's a little secret tip to keep you from getting too stressed. People that pass the NCLEX probably, if you scored the percentage of questions they got correct, it's probably in the 70% range, 60% range, because each question that it's asking you, it calculates you have a 50-50 chance of getting it right. So it's going to find your point of weakness, and eventually, after maybe 10 or 15 questions, it is going to be asking you questions that you're getting every other question wrong. Right? So you get a question right, it asks you a harder question, you get a question wrong, it asks you a slightly easier question. So then you get that easier question right, and now it's asking you a harder question again. Well, if you miss that hard question, it's going to get a little easier. So you're going to be bouncing back and forth between getting questions right and getting questions wrong. Don't freak out about that, okay? That's why everybody who takes the NCLEX says that was the hardest test they've ever taken. So if you're getting questions about stuff you've never seen before, that's a good thing. Okay, don't freak out about it. People who are passing the NCLEX are getting 60%, 70%. That's okay. They're missing a lot of questions. And they don't necessarily know the exact percentage of questions that they're getting right or wrong. The NCLEX is not going to tell you that, but that's just the way that the test is set up. That's the nature of a computer adaptive test. So, all right, I've stammered on about this long enough, but just want you to know and reinforce, don't freak out when you're getting hard questions. That's a compliment. It means you're doing well.